Nemo, 33,
Yeah.
Baltimore. Mm-hmm.
Yeah, hey, can you guys hear me?
Mm-hmm. Yeah, it says you have a question about Humira. Do you have rheumatoid arthritis?
No, Crohn's. Which is the other.
Yeah.
Which is one of the main reasons, I'm questioning it.
Well, it's a new indication for Crohn's, and it works quite well.
New medication.
No, that's not a new medication.
For
it's
Crohn's,
It's a new indication, right?
Indication. I don't know what that means. What do you mean?
Meaning it's appropriate to use it for, that's indicated for that illness. It's
now it's a new. Oh, so
new
they
use.
now say it's a new use for Crohn's disease.
Yeah, and it works quite well. And you're probably concerned about some of the scarier risk factors associated with it, right?
Well, yeah,
It seems like I've seen a lot of commercials for that stuff lately.
Yeah, these are good. That whole class is very good. I mean, it really is revolutionized treatment of autoimmune diseases like rheumatoid arthritis, like Crohn's. Crohn's is a disease where your immune system attacks your gut, mostly the small and large bowel, but it can attack from your mouth to your anus.
So it's like when someone says, I hate your guts, this is like you hating your guts.
This is you, yeah. You hate your
own
guts. Crohn's is you hating your guts. And in the old days, listen to this. It used to, before we could control it, it would get so inflamed that the bowel would adhere to the wall of the abdomen and break through to the surface.
Ugh.
Like the bowel was abscessing out of itself. It's just awful. It's awful illness.
Fun, isn't it?
Oh, it's awesome. And so people get fistulas into their back, into their it was just horrific.
Wait a minute, Drew.
Yeah.
In the old days, you say.
We had Eastern medicine.
What about the wisdom of the Orient?
The Orient could take care of it, no problem.
Well, I don't get it, because the wisdom of the Orient goes back like 2,000 years. You're only talking about 100, 150 years.
20.
20 years. Whoa. What happened to the wisdom of the Orient?
Well, the man didn't let us apply it properly. So if the man had given us the right herbs, we could have cured it.
Could have cured it with herbs.
Yeah.
And now you got to go big pharma.
Now you got to go to the Humira. Expensive drug.
So sad.
Making the man rich.
Yeah. Hey, Nemo, you're in Baltimore. How about a little wisdom of the Orient? You know what I mean?
Well, my girls kind of go in that route, like diet and that kind of thing. And that's all well and good, but my doctor feels like it's at the stage right now where it's durable. And so he's recommending this drug.
Yeah, Nemo, it's not well and good. Unfortunately, your girlfriend's never seen full-blown Crohn's when people's bowels are exploding out of their abdominal wall. And that's how it used to be when people had nothing but herbs.
Nemo,
we live
in a very toxic environment. You understand? The environment is toxic. Drew,
I'm listening.
That phone you're holding?
Yes, toxic.
The rubber on the outside of that phone? That's vulcanized rubber. That's toxic. You understand?
Yes.
That sweater you're wearing has rayon in it. That's toxic. You understand? The glasses you're wearing, that has plastic in it. Toxic. The microphone you're speaking into, that has a foam cover on it. Toxic. Do you understand? Your body is a sponge, okay? Okay?
Okay.
And it absorbs. Look, if you took a sponge and you put it into a sink of dirty water, what would it do?
It would absorb all the dirty water.
It would absorb the dirty water. Okay. Your body's a sponge. This is your sink, okay? Okay? Okay. What would a tampon do if you dipped it in punch?
It would absorb the punch.
Okay. You are a tampon. You understand? You live in a punch bowl.
I'm a tampon?
With a sherbet thing floating in it.
I
Okay? But here's the thing. Your body is a sponge, okay? You live in a toxic environment, okay? You soak up the top of this. This is a bamboo wood grain, but it's not actually bamboo, okay?
I mean, the man created this.
This is plastic.
This is not
3M
natural.
makes this.
This
you
is
have to
natural.
make chemicals for a living, okay? You're putting your hands on this. If you put your hand in acid, you would feel that, right?
What's an acid? Oh, it's that thing that burns.
It
liquid that burns.
It would burn you because you
acid
absorb.
Acid is a liquid that burns.
No, you absorb that, okay? When you touch...
I'm going to start with people don't even know what an acid is.
It's a sponge, and you absorb your environment, and we live amongst toxins, okay? Now, the only way to... Now, when you wring that sponge, well, then that dirty sink water comes out of it, right? God. What if you were to rinse that sponge under some clean mountain water? Okay? Well, that's exactly what we're talking about with these enemas. You understand?
Oh, my God.
Okay? Okay.
So here's
Nemo.
the deal. But here's what kills me. Here's what kills me. When I ask people okay, first of all, it kills me. You can laugh about it. I actually have driven the distraction by it.
Yes, people.
Because I'll say, like, okay, what's an acid? Describe an acid to me even. They have no training to even understand what an
I'm
acid
a sponge. I'm not an acidologist.
So I'll say, just draw me the chemical formula. Just the chemical formula of a toxin, and show me the stoichiometric equation.
But I ate red meat this week, right. And I'm still kind of riding that downward.
God.
You spike. If you eat
you lived with this for 10 years.
You eat a processed food, you have that spike, that high you feel.
God.
When you eat brisket, but then you start to bottom out. I could draw you that molecule, but I'm on a red meat bottom. I'm a super, you know what I mean? I've hit the bottom of my red meat. Who
doesn't know?
I'm, you know where I am? If red meat, if it was a canyon, I would be kayaking in the bottom of it right now.
It's like Portlandia.
Okay.
Right? Everybody's
never
like
seen
Portlandia. Oh, my God. Okay, Nemo, let's get to the question.
Oh.
So, Nemo, so you're worried about lymphoma, right? That's the big, horrible side effect from Humira, right?
It is.
Exactly.
Yeah. It's exceedingly rare. Yes, you have to decide with your doctor if it's worth the risk. It's something that does happen, but it's so rare. And I've got many, many patients on Humira whose lives have been, the trajectory of their illnesses have been completely
changed. You get cancer from Humira?
Nah, there's some concern about that. It's not actually proven yet, but it's concerned.
But it's one of these, it's better than whatever.
Better than your bowels splitting open through your abdominal wall, and better than taking prednisone, which was the old thing for
Right.
I'm sure you're on something like that now. You're on Asacol, and are you on Asacol and prednisone?
Pentasa.
Pentasa, rather. I beg your pardon.
Who would
Pentasa.
name All right.
Yeah, Pentasa, and that's also typical stuff for Crohn's. Is it controlled with the Pentasa?
Not really, no. I mean, I'm not suffering, but it just sort of keeps it at bay. Like, I can always sort of feel...
Yeah, so that maybe the Humira can go for a while and get it, in remission, and then you go back off it, possibly?
Nemo,
Yeah.
How about one of those magnets you put between your box spring and your mattress? Hold on a second.
Magnet on your wrist.
Your wrist.
Yeah.
Okay. Picture a circuit
Do you know
board.
Makes my skin crawl when you do this stuff?
Picture a circuit board. Your body is a circuit board. All right. Okay. It's electronic. It's your brain. It's a giant battery.
How do cells communicate?
It says it communicate through electricity. Okay. Now, what if something was to interrupt that circuit board? What if I took coffee and I dumped it all over that circuit board? Yeah. Okay. Okay, because that's what you are. You're a sponge attached to a circuit. You're a circuit sponge. Okay? What if we took that circuit board and we threw it into that dirty sink water with all those toxins?
Disaster. Blow up.
All right.
Sparks.
What this magnetic hernia truss does for me is it pulls. You know how when I take a magnet, okay, let's say there's iron shavings everywhere. And I take this magnet and I put it in the middle of the iron shaving. Well, it's all drawn to it, isn't it? What's it do? It pulls it to the magnet. So instead of having these shavings everywhere, when I put on my magnetic truss, I am pulling all of the circuits to the core.
Oh, to your chakra. Your chakra.
My chakra. It's my core. Okay? And it pulls the toxins, and it pulls your body. You're just one circuit board of electricity. And again, if a raccoon urinated on your circuit board, what would it do? You'd short out, wouldn't you? Okay, that's all it is.
Enough said.
That's why you need the magnetic bracelet, because it pulls.
I blame all this on the lack of science education. I really do. Nobody is trained in science anymore or basic biology.